Pneumonia by Allie Johnson. Pneumonia is an acute lung injury, or an ALI, which just happens to spell my name. It is an infectious and inflammatory disease affecting the parenchyma of the lungs. In lobular pneumonia, one or both lungs can be affected at the level of the lobe, and in bronchopneumonia, it occurs more distally at the bronchioles and alveoli. A person gets pneumonia when the normal defense mechanisms fail to protect the lungs from infections, such as bacterial infections, viral, fungal, or mycoplasmal infections. It is either a primary or secondary infection, which often follows influenza, and can be acquired through the community or in the hospital. Nosocomial infections have twice the mortality and morbidity of non-hospital acquired infections. Pneumonia can also occur through inhalation of toxic chemicals, smoke, dust, gases, or aspiration. Pneumonia causes inflammation and edema in the terminal bronchioles to then fill with infectious debris and exudate, and then air cannot enter the alveoli and gas exchange is impaired as a result. This also causes ventilation, perfusion abnormalities, and difficulty breathing. Pneumonia is very common, affecting older adults and children, and there's more than 4 million cases a year, and it is one of the leading causes of death in the United States. Most cases are viral, which are usually not life-threatening except in immunocompromised individuals. There's different characteristics for bacterial pneumonia compared to viral pneumonia, but overall patients will present with flu-like symptoms, pleuritic chest pain, which is when pain worsens during breathing, confusion in the elderly, tachycardia, fever, crackles and wheezes, a productive cough, often with pus-containing sputum, and clinical signs of dehydration. Most cases of pneumonia result in 1 to 2 weeks, but they can last longer. There's different medications prescribed for bacterial versus viral pneumonia. For bacterial, a lot of times it's antibiotics, erythromycin, doxycycline, fluoroquinolones, cephalosporins, penicillins, vancomycin, and in viral, it's oftentimes preventative with vaccines recommended for anyone over 65, and supportive then when they have it for rest, high fluid intake, good nutrition, sleep, reduced stress. Both bacterial and viral, they generally recommend nebulizers and physical therapy. So some studies, the one study looked at intensive physical therapy with physical therapy occurring 7 days a week, and standard physical therapy occurring 3 days a week. Both worked on range of motion, positioning, functional mobility retraining, and intensive also incorporated some muscle strengthening. They found that intensive did not improve performance compared with standard physical therapy, but it might be beneficial for patients who are experiencing weakness as a result of deconditioning. The other study looked at early rehab for in-hospital mortality, and they found that early rehab within 2 days was associated with reduced in-hospital mortality. So this causes the exudate in the alveoli causes decreased ventilation perfusion ratio due to poorly ventilated exudate-filled alveoli, which decreases gas exchange and impacts compliance of the lungs, and the increased mucus results in increased airflow resistance. So for physical therapy, we want to improve the ventilation perfusion ratio for better oxygen transport and gas exchange. And we can do this through mobilization and controlled breathing techniques, positional techniques to increase ventilation and perfusion matching, which is often done in the prone position, and just overall to offset aerobic deconditioning that can occur with pneumonia. And it's good to remember that we should not cause the patient to demand more oxygen than their body can supply. And these are my references.